Hi guys, my name is Peter from Art of Physio, and this exercise is to improve the range of motion and control in your hip. So in this exercise we're trying to move the hip through its full range of motion without using the rest of the body, and really isolate what that hip is doing, and in the process explore where the tight spots are, where the sticky points are, and how we can work through that and improve the control and range of motion in the hip. So I'll start with just showing you the exercise, and then I'll elaborate a little bit more and give you some different variants you can do to hit the spots that you need to hit. All right, so let's start off with the basic one. So you're going to stand up nice and straight. If you need a wall, if you otherwise fall over, that's completely fine. Just hold the wall for balance. Yeah. In a different variant, we're going to lean into the wall, but that's for the next variant after this one. Yeah. So in your hip, you have three planes of movement. So you have flexion extension that's going up and backwards. You have ab and adduction that's going sideways, and you have rotation capacity. So we're going to move them all over those three planes, but we always want to move one plane at the same time. So we're not really going to combine the planes, but we're going to move into flexion first, then adduction, and then move it through there. Yeah. So I'm going to talk with my left, or I'm going to move with my left hip. So first, I'm going to start with lifting it up, and lifting it up as far as I can by actively holding it. I want to keep my body upright and prevent my lower back from joining the party. So my chest is up, and then I move my hip. At this moment, if I go higher, you see my pelvis wants to join, yeah, and my lower back. So that's where I stop. So I move it up, then I move it to the side. And you'll notice that I'm really trying to keep my body over my standing leg, and that I'm not rotating my shoulders along with it. So I really want to just isolate this hip movement, and this hip stays completely still. Then from there, you're going to see if you can twist that way. So I'm going to twist, then I'm going to move my leg a little bit more back, twist, move it back, twist, move it back, and move it all the way back, and then bring it back. Then we're going to do the reverse movement. So then we're going to extend first, then rotate, then bring the knee up and bring it back in. That's one rep. I'll show you from the side so you can see a little bit better. So I'm moving my hip up to the side, rotating, going back, rotating, going back, rotating. So even though it looks like I'm moving those planes of movement at the same time, I'm actually rotating, moving back, rotating, moving back. So really see if you can isolate those movements in your head. Then for the reverse, we go back, we twist up, and we bring it in. So that's the hip rotation. So you can do this in different variants. You can do this seated on hands and knees, principle's the same, or you can do it leaning into a wall. If you notice, or if you don't feel like, or if you feel like you move your other hip to move the left hip, then what you can do is lean into the wall. So I'm literally pushing myself into there. I make a plank with my body, quite push into the door quite hard, and then from there do that same exercise. There, rotate, and move back. Reverse, there. There you go. What this will do, this will block you from rotating your upper body to join the party. Yeah, that's already a little bit harder. What you can also do is lean in sideways. So you lean into the door or the wall with your shoulder. Also here, as if you make a side plank, and then from here, make that same movement, go that way. And that will prevent you from moving sideways when you do this exercise. So you kind of block that movement and that compensation pattern. That will make it pretty hard. And what you will probably notice, the harder you make it, so if you push into the wall or if you lean into the wall with the side, the movement is going to be smaller from the hip, but it should be more specific. Yeah, during this exercise, you will probably feel that all the muscles that surround your hip, so that's generally the glute region, that's where it will start to burn. Yeah, and that's good. because then you're actively contracting muscles. If you feel like it's cramping, ease off a little bit, make the movement a little bit smaller or go a bit slower, yeah? So slower and a bit smaller. That can really help against the cramping of the muscles. Yeah, so all we want to do is isolate the hip and not move the rest of the body. And this is a great exercise if you have low back pain, if you have, sciatic type of symptoms in your glutes, or just for overall hip health. This is a great exercise and a great way to improve it. Yeah, good luck. Let me know if you have any questions, and we'll see you the next time.